Hey guys, Kate and Mandy from K9, and we are going to be setting up fake vet visits for you. So this is probably one of the number one things that I either have past clients or people that are going to be coming to work with us, or just you virtually asking how to get your dog better at the vet. So I want to preface this by both of the dogs that we're going to be utilizing aren't like major bite risks or anything like that. Little Poppy, who we're going to work with first, is definitely very nervous. So she's a great example of a dog that like might not take food at the vet, could potentially be a bite risk if put under pressure. Because again, regardless, there is going to be pressure put on your dog when you go to the vet. They have to be touched. They have to get their vaccines, ears checked, all of that kind of stuff. So our goal is to hopefully help you be able to make your dog's vet visit a little bit easier. So we set up this card table. Most of you probably have one. You don't even need to utilize this, but I do find for smaller dogs, most often they're getting put up on, the vet table. And then I also find that for some of our really nervous or even reactive dogs, they do better being put up on the table, even if they're larger, versus being on the ground and having the vet or the vet techs coming into their space. So both of our dogs, which I would say they're larger medium dogs, we actually have both of them go up on the table, and we do like a level of head and body control. So we're going to start with Poppy, and Mandy's technically going to be the vet and I'm going to be the owner, but I'm going to be a very knowledgeable owner that I understand that sometimes the vets are just going to have to do things the way that they do it. But you can practice this at home and hopefully work with your vet of showing hey, my dog does really good if we set it up this way. And most vets that you'll find, if you can see that you're trying to work with them, they'll work with you. So for instance, with Miss Poppy, I would bring her in on her slip lead and e-collar into vet visits. I would ask for the vet ahead of time not to come in and baby talk her a ton, because that actually makes her more nervous. Just keeping it super neutral, talking to the owner versus talking to the dog. And then I would have the owner, which is me in this setting, pick up the dog to put her on here. So I would pick her up and set her on the table. What I like to do right off the bat is put my hand under the belly. And I usually keep my leash nice and short, but not tight. So I'm not holding her here and creating tension. The reason I like to put my hand under here is most dogs that are nervous like her will want to crumble on the table. And so often, if vets need to take blood or something, they need to get it from the back leg or the standing front leg. So most often I have found, again, from having a dog that I need to be so proactive with at the vet, this helps him so much so they can get everything done they need to get done. They usually do his vaccines back here or right here, and then blood draw from the back. So what I would start with is, again, everyone's on a time crunch, but usually I start like this and the vet starts their exam. So why don't you start, Mandy, with the rear end of touching her belly like this, lifting up her tail, all of those things. So while the vet needs to touch the stomach, so touch right under here, I would just move my hand up a little bit, but push into it, put pressure. Good girl. I will offer Poppy food. Good, she's taking it right now. And go ahead and pick up her legs, look at everything, kind of push her joints in and out. Because again, you have to remember, vets are gonna know what they need to look for. So they're gonna be touching your dog in a very comfortable way of I know if I'm looking for any pain, I'm looking for how's their overall health. What I want you to do now is let's actually just use her e-collar remote, is come under her chest to her heart as if you're checking her heartbeat. So then here we have to be very quiet. So just hold still and kind of put pressure on her. Good. Notice in this time too, when your vet is trying to check your dog's heart rate, don't talk very much. It makes it go quicker. Good. Why don't you let her know good? Because often the vet does talk more than what we are. Mandy knows keep it neutral. But a lot of the times the vet is good boy, Rhodey, good boy, Rhodey, or would probably be good girl, Poppy, good girl. Good.
Good, Poppy.
Good. All right, you can stop with that. Now what I want you to do is, so I'm going to go to head control. So she's not buckling her back end a little bit. So right now I'm going to use both of my hands. So I want to keep her head kind of forward. So I'm just going to cup her hands a little bit. I want you to, so right here is a good example. I want her to keep forward. Good girl. So I might stand here. I want you to really grab her scruff, pinch it. Good. And bring the pen as if you're going to give her a vaccine. And just give a little push and make a click noise. Good. Good. I want you guys at home to remember how it's going to be at the vet. Like, they really do have to like grab to get that scruff. Like, practice those things at home. Be a little bit more like, good, perfect. Good job. Good, Poppy. And yes, I'm holding her head here, but I'm not like squeezing it. I'm keeping it nice and neutral. Good. I have the leash here if needed.
Good, Poppy.
Good. Pause on that. And then once you come check her ears out. This is another great thing. If your dog is potentially nervous about this, put your thumb over their mouth a little bit. Like, both of my dogs are muzzle conditioned for the vet because priorities for the dogs that I have. But here, like, I'm not concerned she's gonna bite Mandy, but I do want her to be comfortable with me like holding her face. Good. I would grab, because sometimes at the vet, they do like the ear cleaning solution. They might wipe out your dog's ears. So I want you to really get in there with them. Like, push in, because again, if she had an ear infection, this is Birdie, our personal dog's worst nightmare, and it hurts. She is very uncomfortable with them shoving their fingers in her ears, but it helps her after. Good. Good. Nice, Mandy. Good. I would practice walking to the other side, because often the vet will go from side to side and then do this ear. Good. Notice how I am still doing head control, but I'm letting the vet do the handling of the actual ear. If you have a dog that is so sensitive to being touched on the face, like for instance, your dog needs to be muzzled, they just might not do a tooth check. Like, make sure that you as the owner can. Maybe take pictures for your vet. That's what we actually do for Rhodey, is he keeps his muzzle on the entire session and I check the teeth. The vet does check his eyes, so like same thing, once you just open up her eyes. Good.
Good, Poppy.
Good. Come to the other side and do the other one. That's my good girl. Notice how, again, I'm focused on the dog, not what the vet is doing. Good. She's so good.
Good, Poppy.
Good. Why don't you just do some like random like opening and closing of syringes, like near her rear, at her foot, like picking up her foot as if you're going to pinch and try to find a vein. Good. Good job. Good. That's my good girl.
Good, Poppy.
What I would do is, while her foot is still on the ground, come and like pinch some of these parts of her skin. Yep,
Okay.
good. And then I'll do this again, because that's as if they were getting a blood draw. They'd want the dog's foot standing, and then they would take the blood from there. But again, look, I have her, it's almost as if she's a little show dog. This is how they would hold their dogs, is head control, body control. This will help your vet so much more, and then be able to get your dog to get things checked out. Good. Okay. Say we need to check something that's like under her belly or something like that. For a dog like this, honestly, if she was mine, I'd probably do something like this and have the vet come check this direction. And I would just watch her head control. So just come check. Good girl. Good. Again, if she was a major bite risk, I would not have her like that. I would potentially put her, so tell her good.
Good, Poppy.
I would then put her down, and then I would potentially practice good girl pop. Putting her on her side. Again, this might be a little tough on a table. I've done it on a soft bed with her. Shh. Good girl, Poppy. Shh. I know. Good girl. Good. And we're just going to do this right now. So just feel her leg. I've got her here. That's good. I'm not putting any pressure to keep her here, you guys. If that at all looks abrasive to you, imagine if this isn't practiced. Imagine a stranger doing this to your dog. I'm not a stranger to Poppy anymore. I'm still not her person either. So she might, you know, with me, she has a lot of respect. So it happened very quickly and she did such a good job. But imagine the stress she would go under at the vet office if she has zero practice doing this. That's why if you can practice these things at home, you know, if she had a paw injury, we could put her here. If she had a stomach injury, if they needed to take an x-ray, she's uncomfortable a little bit right now, but she's doing so, so good. And then break. Good. Good girl. And then let her know she's doing such a good job.
puppy.
And I do feel, obviously, she likes Mandy and stuff. If she's softening up to your vet, you can have your vet offer her food, anything like that. Once she's done with her exam, instead of making it a big deal, I just do the same thing. Pick her up. Good girl. I'll put her into a poppy sit. Good. Like, she's totally happy. I don't even know if you guys can see her in the video, but she's back to her like, oh, all right, I did a great job. And then I'll give her a jackpot of treats. If it's benefiting your dog to give food while the vet is working, fine. But if you're finding that's just really escalating your dog or anything like that, you could also do this at home, where it's just like, just put your dog up here and give them some of their treats, where it's like, oh, coming up here is not that big of a deal. It's not so crazy. If, again, your dog also really struggles at the vet, you can check with your vet ahead of time, like, hey, can I come in a few times before our actual visit and practice a downstay in the lobby or practice going to an exam room? And a lot of vets will work with you on that, but you need to practice those handling type things. I'm gonna also practice like those kinds of noises. If she had an irritation, practice giving a squirt, like these kinds of things. It's a hot spot spray, so like you can put it anywhere on your dog and it's not going to affect him, even though you don't have a hot spot. But so often our dogs go into the vet completely unprepared for being successful, and some will do totally fine. Some will be probably crazy, like the next dog that we're gonna work with, he might just be like, yay, you're touching me. But for our nervous dogs, for our reactive dogs, for our honestly rude dogs, so even if they're overexcited, like jumping on the vet, I've had one of my clients as a vet, and she's like, honestly, some of the friendliest dogs are the worst to work on because they're jumping. Like, one almost broke my nose. So it's like every single dog could value or have value from practicing this at home with you. And then you're going to feel more successful when you go in as well. So if you have any questions on nervous dog stuff, feel free to let us know in the comments, and happy to answer that. And stay tuned for the next